Nurse midwife. Nurse midwife, a person who is trained in both nursing and midwifery and, in the U.S., is certified by the American College of Nurse Midwives ACNM. In order to practice this, a nurse midwife must pass an examination for certification by a national board. Nurse midwife training focuses on the management of women's health care, particularly pregnancy, childbirth, the postpartum period, care of the newborn, and gynecology. Nurse midwife training promotes a non-interventional, individualized approach to normal pregnancy and childbirth, involving a certain amount of women's education, an approach that is often time-consuming. Historically, nurse midwives arose in the U.S. to serve the poor and address high maternal and infant mortality rates among the underserved. The Frontier Nursing Service was the first nurse midwifery program in the country. Under the leadership of Mary Breckinridge, British-trained midwives were recruited to rural Kentucky to safeguard the lives and health of mothers and children. Their care resulted in marked reductions in maternal and infant mortality. In 1932, the Maternity Center ASSN opened the first American educational program for nurse midwives. It was in Harlem. By 1944, there were 6 schools for nurse midwives in the U.S., including the Catholic Maternity Institute in New Mexico, which aimed to provide maternity care for the poor Spanish-speaking population of the Santa Fe area. Midwives in Ireland, Scotland, and England deliver more than 65% of all babies, and the proportions in Denmark, Sweden, Norway, Finland, and Germany exceed 85%. These countries have fewer obstetrical interventions than the U.S., as well as lower maternal, neonatal, and infant mortality rates and higher rates of breastfeeding. A nurse midwife is said to be engaged in the practice of nurse midwifery. If certified by ACNM, the nurse midwife is a CNM certified nurse midwife. And you are S E M I D W I F E nurse midwife.